You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered.
All right, folks, man, this story is just so sad out of Michigan. Here we go to my iPad. This young girl here, her name is Skylar, 5 years old. She is the daughter of two emergency first responders there in Detroit. She has passed away from coronavirus. She developed a particular condition as a result of contracting coronavirus. I think it was on April 29th, according to the story here, is when she, I'm going through the story again, she's the youngest person on record to die with COVID-19. Well, prior to her passing, the youngest in Michigan was 20. She's 5. On March 29th, she was admitted to the hospital. She developed a rare complication of the coronavirus, meningoencephalitis, which causes swelling of brain tissue and a lesion on her frontal lobe. She was on a ventilator, and the family made the decision to take her off the ventilator because she was brain dead. Folks, so many of our people in Detroit have been impacted. So many African Americans. Every African American, every person in Richmond, Virginia, who has died from coronavirus is African American. Every person in St. Louis who has died from coronavirus is African American. And when you hear the phrase, when the country sneezes, black women, first of all, when the country sneezes, or when the country gets a cold, black people get the flu, then of course the country gets the flu, black people, we get pneumonia, we can go down the line. But the question is, what now happens right now when we talk about the coronavirus and the impact of pregnant women? Not only the people who, now here's the other piece, now because shelter in place, look, people are together. Also, according to various studies, having more sex, we can expect to have in 3 months a number of women who are going to report they're getting pregnant. But how should they take care of themselves in these times? Dr. Rashonda Mitchell joins us right now to talk about this very issue. Glad to have Rashonda on the show. Rashonda, you were at the University of Virginia, correct?
Yes, I am.
Okay, all right then. Go ahead.
I am at the University of Virginia, and I'm finishing my fellowship in maternal fetal medicine, which is specific for high-risk pregnancies. So we are having a lot of moms come in with a lot of anxiety right now.
Mm-hmm. And what are their concerns?
Well, of course, there's a lot that we don't know about this virus. And so they want to know, how does this, affect my pregnancy? How is this going to affect my delivery plan? Who can attend the birth of my child? So these are all concerns that we are hearing as it relates. And to be quite honest, I know some women who are at this point trying to avoid the hospital because they don't want to be exposed possibly to the virus. So we have to get the proper message out there specifically to our Black and brown mothers related to this virus.
And so what are you advising them? Because I know there's some folks I know who they recently had children, and the fathers could not be in the room with them. We had Gerald Albright last week on. Him and his wife have not seen their first grandchild because of coronavirus. And so what type of precautions should we be putting in place? What, in terms of even taking care of, once we find out that woman is pregnant, what should we be doing?
Okay, so the first thing I would like to say is definitely go and receive prenatal care. Prenatal care is important to ensure the best outcomes for both mom and baby. So yes, even though in the middle of this pandemic, we do want you to receive prenatal care. So reach out to your provider and schedule the routine prenatal care. The second thing is what everyone else can do, because initially, pregnant women were put at higher risk because we didn't know how this virus would the effects that it would have. So pregnant women were considered high risk. But right now, pregnant women, they have cleared them and said that pregnant women are at the same risk as healthy individuals. So right now, you just follow the same guidelines that the CDC recommends for everyone else, which is social distancing at this time, also washing your hands for 20 seconds with soap and water. If you're out and you're in, a high density population or a place and you're going out, you should wear a face mask. Those are the general recommendations right now. But if we're considering what to do in the future, things you should discuss with your provider is call them first and see what their process is, because a lot of doctors' offices are instituting rules on how many people can be in the waiting area.
Mm-hmm.
So you need to ensure that you know the proper thing to do when they schedule your appointment. Should you wait in the car until they come and check you in? So first call your doctor's office, set up an appointment, and see what their rules are. And if you're close to delivery, the things that we would recommend is you should have a discussion with your provider to ensure that your birth plan can be followed, and making sure that you do have a support person in the room. We do know that women of color are at greater risk for maternal mortality. So having that advocate or that one person with you, it's important that that person can be allowed. And that's going to vary from hospital to hospital, depending on the density of how many positive people they have in the area.
All right, I got my panel here, so I got to bring them in with some questions. Let's see. Robin, you're first. What's your question for Doc? Is Robin there?
Oh.
Robin, you there?
You said Rob or Robin?
Okay, first of all, I'm sorry, Randy. My apologies, Randy. My apologies.
No problem. I'm wondering, is there any gear possibly that they feel someone could wear to be allowed in the delivery room? I have a very dear friend whose wife is pregnant right now, due at the end of June, and he's just wondering if they have the proper attires or any possibility of him getting in that room. He said he's willing to wear anything. He just wants in there when his daughter's born.
I'm sure it is an exciting moment, and we love to have our support persons, our fathers or significant others in the room during that time. But depending on what hospital it is, some hospitals are allowing at least one support person in the room during the delivery. And it is typical that in the delivery room, if it's a C-section, you're typically have a face mask and face shield on anyway during that time. So I don't know if their healthcare provider told them that they would not allow a support person, but there's not really anything different that we could do besides recommending the normal face mask that we have. And hopefully that she's not positive and we don't have to worry about that. It's only usually when women are COVID positive that we are a little bit more concerned, and we typically don't allow that support person in the room.
Avis.
Okay.
So what would you tell families just to, assuage their fears or make them feel more comfortable about even giving birth in this environment in a hospital, period? Hospitals are, quite frankly, notorious for being a place where people can catch infections and they can be exposed to things that they didn't have when they came in the door. So given the high level of transmittal of this particular virus, how can you make people feel comfortable to have an in-hospital birth at this time?
I would definitely have that discussion with the provider and the hospital to understand what their processes are for pregnant women. So one of the things that you can do is I will let you know, on labor and delivery, we typically have healthy young women or individuals there. So we don't have a high rate. And if they are infected, they're usually isolated in a negative pressure room. So most of the people that they're probably going to be exposed to are healthy individuals. And I know that the providers in and of themselves, we are limiting ourselves to be exposed to the virus. So that what I mean by that is that if there is a COVID positive patient, that person is only seen by one provider to limit exposure so that the other providers don't have to be exposed. So the first thing I would say is labor and delivery typically has a lower rate of sick individuals compared to other floors, because we do know that we have babies on the floor. And so we try to limit our very, very sick moms and the access to them. The second thing I would say is talk with your healthcare professional to make sure that they have face masks that are appropriate and the PPE that is needed for delivery, depending on what type of delivery that they have. And if they have all of those things, we've delivered women and everyone came out without being exposed at this point in time.
Final question, Rob.
Dr. Mitchell, what do you think about pregnant women that are maybe not super young, but not necessarily old, but like 40 plus having babies? Is there anything that you need to take under special advisement with that situation?
Well, the thing with our older, or I like to say our more mature mothers, is making sure that they're in the best health possible. The only risk factor is that the older you get, the more likely you are sometimes to have other comorbidities such as diabetes and hypertension. So ensuring that both of those things are under control. And then besides that, I think there should be no additional precautions that are needed. Is just doing the typical things that pregnant women do as far as washing hands, social distancing, nothing in addition to that.
All right, then. Well, Dr. Rashonda Mitchell, we certainly appreciate it. Thank you so very much for your expertise. You know, our goal is to present Black doctors and scientists here to give them an opportunity to share their knowledge with our audience. And so we certainly thank you for doing so.
No, my pleasure. Thank you. Anytime.
Fam, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.